Good afternoon, Missouri City. I'm your Mayor, Robin Alakat. We come together today to talk about the most important thing, which is COVID-19 that we're dealing with, and especially in Missouri City and throughout the country. I want to start off by wishing everyone a Happy New Year, and we want to make sure that we have a round of people that are here that will be talking about things that are important to COVID and related to COVID as well. So we have Mayor Pro Tem Anthony Maroulis. We have our Dr. Joe Anzadula, and we have our pharmacist, Dr. Mona Finley, our city manager, Otis Jones, our acting fire chief, Mario Partita, our state representative, Ron Reynolds, will be the speakers that will be speaking today. So, throughout 2019 to 2020, we dealt with this issue, and the city has done a fabulous job of doing a great job with managing this. So today, moving forward as of 2021, we're going to be coming to you every 3 weeks and talk about what's important and how important this is to our citizens. Without further ado, I will ask Mayor Pro Tem Anthony Maroulis to come and say a few words.
Thank you, Mayor, and thank you, staff, for putting together this news conference. As a healthcare professional myself, I have seen the toll this virus has taken upon...
Raise the microphone.
Raise the microphone?
Just squeeze the grip.
Yeah. As a healthcare professional, I've seen how this virus has taken toll on our families. We must all do our part to flatten the curve, and especially amongst some of the seniors that we have in our community. Our city is committed to helping you. Our city is committed to helping the community. We especially want to help those seniors by providing PPE. We want to provide you some information on the vaccinations, and we also have healthcare professionals today to provide you some data. Through our emergency management team, we also will be providing PPE kits at a later date. More information will come, and you can contact us at 281-403-8500. Lastly, we have medical experts on hand today, and they will discuss COVID-19. They will discuss the vaccine and processes for receiving the inoculation. Before we move on to that, I'd like to introduce you to City Manager Otis Jones. Thank you.
Thank you, Mayor Pro Tem. Missouri City residents, I just want to assure you that the staff here at the city is prepared to respond to this challenge. We've met this challenge dead on its head from day one. I've appointed both Dr. Anazula, who will lead our medical efforts in responding, then also to Chief Partita, who leads our emergency services response. Our responses have been not only fielded and grounded in science, but led by science in terms of our operation. And we're dealing in that in two parts. One, have an effective emergency response, which Dr. A has led us and will continue to lead us in making sure our efforts in the response is grounded in science. But also too, Dr. Partita, Chief Partita works with our staff to ensure that we meet the test in terms of how we open as an organization, but how we function as an organization to deliver services to you. I'm going to introduce Dr. A to you and allow him to address you.
Good afternoon, Missouri City. Thank you for having me today. So COVID-19 remains a threat to our community, as evidenced by the alarming increase in positivity rates we're now seeing, especially in certain areas of Fort Bend County, such as Missouri City. Total cases since the pandemic here in Missouri City are 3,172. Current active cases is 652, and the current death total is 75. Fort Bend County, we have a number of deaths as of the 4th of January, 370. And just for a point of comparison, we had 308 December 28 of 2020. Testing positivity rate is currently at 14%. And just to digress a little bit, The test positivity rate is one of our metrics we use to determine the level of transmission or rate of spreading of the virus. Our goal is to keep that number 5% or less over a sustained period of time, at least 2 weeks. So our goal is to keep it at less than 5%, and we were doing really well before the holidays, early fall. Unfortunately, our current rate is 14%. So as you can see, it's gone up dramatically. We saw a similar spike this past summer, and I suspect the trend will even be higher. The SETRAC data, which covers our region in Harris County and neighboring counties, we have 155 beds that are being used in Fort Bend County, 40 ICU beds are being used, which is an increase from a few weeks ago, and the case fatality rate actually has dropped a little. It's 1.1%. It used to be about 1.4%, but I suspect that although we're seeing more cases resulting in more hospitalizations, there are not as many deaths compared to this summer. So it appears that we're doing a better job managing COVID-19 patients, especially because of better technology and better medications. The county continues to remain at a coronavirus level of red, which is the highest level of community risk. We expect to see the surge during the winter flu season, mostly because of the recent holidays, with more people traveling and visiting relatives and friends, and because people are spending more time indoors because of the colder weather. So please, we should all continue to take all the necessary precautions to stay safe. Now is not the time to be letting our guard down. Missouri City continues to work with local and regional health authorities to ensure we remain informed of issues that impact the safety of our community. This includes the distribution of new vaccines that will keep our community safe and help us return to a more normal way in the months to come. It's important that as many people as possible take advantage of the COVID-19 vaccines when they become available. The first FDA-approved vaccines are now being provided to first responders, healthcare workers, and long-term care facilities such as nursing homes. In addition, people 65 years and older and those with medical conditions that can predispose them to COVID-19 are now eligible. To ensure the effectiveness of these valuable resources and create the herd immunity that we hope will protect our families, we must get vaccinated. So unless you have a severe allergy to injectable medications or your doctor tells you otherwise, please try and get it when it becomes available and when you are deemed eligible. I know many are asking if the vaccine is safe, and I can't stress this enough, but I believe this is a resounding yes. Here are a few things to know about the current COVID-19 vaccines that have been recently approved by the FDA. Vaccines are considered to be a very important tool to stop the pandemic. Although we only have 2 vaccines that have been approved under the EUA or the emergency use authorization by the FDA, there are many more being developed and are waiting to be approved. The vaccines are free to all Americans, and there are no associated costs. Currently, there is a limited supply of COVID-19 vaccine in the U.S., but production and distribution will start to ramp up in the next few weeks to few months. Currently, there are 2 approved vaccines, one's from Moderna and the other is Pfizer, and they're both a 2-shot series. And the reported 94% effectiveness is not achieved until both doses have been administered. So the second dose of the vaccine must be given within the specified time frame after the first dose. So please consult with your healthcare provider for specific guidance on the vaccine that you are getting and obviously your health. Vaccinations are still recommended even if you've had the COVID-19 and have recovered from it. Since the current vaccines do not use live virus, you cannot get COVID-19 from getting vaccinated. After COVID-19 vaccinations, you may experience some side effects that are felt to be very mild, such as a sore arm or a headache, maybe low-grade fever, or maybe even body aches. For most people, these side effects should not impact your daily activities, such as going to work or going to school. Symptoms should resolve within just a few days, and again, the vaccines are safe. So until we have sufficient number of Americans vaccinated, herd immunity, everyone should continue to take the following steps to prevent the spread of COVID-19. Wear a mask that's fitted appropriately to your face. That means covering your mouth and your nose. Stay at least 6 feet away, apart from others, especially non-family members that are not living in your household. Avoid large crowds and gatherings, especially in poorly ventilated indoor areas. Wash your hands with soap and water or hand sanitizer with at least 60% alcohol. Stay at home if you're sick and call your healthcare provider for any further instructions. Get a flu shot as soon as you can if you are eligible and if your doctor says that you can. Clean and disinfect frequently touched surfaces, especially at your workplace. So remember the 3 W's. Number 1, wear a mask. Number 2, wash your hands. And number 3, watch your distance. For more information and updates on the coronavirus and vaccinations, you can visit the Texas Department of State Health Services at www.dshs.texas.gov. The Fort Bend County now has a vaccination hotline, and you can call them. The vaccination hotline is 832-471-1373. Again, the vaccination hotline here in Fort Bend County that you can call is 832-471-1373. Thank you for your time.
I'd like to also ask Dr. Finley if she can step up and talk to you a little bit about our efforts with respect to administering the vaccine within the city.
Hello, I'm Mona Finley with Glen Lakes Pharmacy. We're located here in Missouri City. We're one of the first distributors or first providers to receive the Moderna vaccine. We have already administered a little over 200 vaccines. We are out at the moment. We will be receiving more real soon. We're asking you to please go to tinyurl.com/GLP vaccine. That's G as in Glen, L as in Lakes, P as in Pharmacy, vaccine. The vaccines will be administered by appointment only. So if you please register, we will contact you once we receive the vaccines to schedule your appointment. Thank you.
Chief Pertia is going to come up and talk to you a little bit about what our emergency response is and what we're doing to take precautions also with respect to the opening. Chief.
My name is Mario Partita, Acting Fire Chief for Missouri City Fire and Rescue Services. There are 2 services I want to discuss or share with you that have been working for you behind the scenes. The first is the Emergency Operations Center that's under the direction of the Emergency Management Division. The Emergency Operations Center has been open to specifically address COVID response since March 12th of 2020. We remain open 24 hours a day, 7 days a week, and we're operating virtually weekly with weekly staff meetings with directors from every department where we review PPE levels to make sure that we have adequate PPE to carry us into the future. And we also go over needs that any department might have that week to deal with COVID. We also look at service level impacts in any department to see if there's any impact that from that week's report. And we also discuss safety. The entire effort of the Emergency Operations Center is to keep our city leaders, council, the mayor, and you, our citizens, informed on our preparation and response to the COVID pandemic. The second part I want to mention is that we also have your firefighter first responders that are working behind the scenes day in and day out. They are medically trained all the way up to the paramedic level, and they support Fort Bend County EMS on all EMS 911 calls. One thing I'll ask is for you to help our first responders keep you safe, and that comes with when you call 911 is providing us as much information as possible, and 2, when they arrive on scene, they're there to help you in your time of need. So anything you can do to give them some distance, family members, bystanders wear a mask. Our first responders also carry extra masks, so if bystanders need masks, they will hand them a mask. But that's an effort for us to work together to take care of our patients and take care of your loved ones. So together we'll get through this together with your help on these calls. And with that, that's my report for Fire and EMS and our Emergency Operations Center. We'll continue to work 24 hours a day, 7 days a week for you. I'd like to turn it over next to Representative Ron Reynolds. He's going to speak before you.
Thank you, Chief. I want to commend Mayor Ellicott and the City Manager Otis Jones and the City of Missouri City's Emergency Management Department for hosting this. This is a great, transparent way to keep the citizens abreast of the dynamic changes that are taking place. First of all, we know that with the rising numbers that have been stated by the physicians, we all have to be on guard, on heightened alert with respect to how we deal with COVID. This is a highly transmittable disease. This pandemic has ravaged this country and this state. And so we want to continue to keep the citizens safe. And I believe that the protocols that we have in place will help to do that. Certainly, it's encouraging that we have the 2 vaccines in place that the doctor has talked about with respect to Pfizer and Moderna. And I anticipate, based upon the new transition of power, that the President-elect will introduce the Defense Production Act to get the production of the vaccines in high capacity to deal with the demand. And as was stated right now, we don't have enough vaccines to go around. But certainly all of those who are in Category 1A are frontline healthcare workers, and Categories 1B, 65 and older, and those 16 and older with a some kind of compromised immune system, you need to certainly make appointments to get the vaccines. A lot of people have really had concerns about the way that Texas has rolled out the vaccines, and I share those concerns. And I want to be very transparent in stating, first of all, that we have not, as a state, been as robust as we should have with getting the vaccines to the local communities. I am happy to report that Texas has convened a team of appointed external and internal subject matter experts into the COVID-19 Expert Vaccine Allocation Panel to develop vaccine allocation strategies as recommendations to the Texas Commissioner of Health. The panel will develop and apply guiding principles in their recommendations. Some of these principles may include equitable distribution across urban and rural communities, and considerations of applications, guidance for vulnerable populations. The guiding principles are under development and will be finalized by this panel. Then they will make their recommendations and send them to the Texas Commissioner of Health for final approval. And it's already been stated that the vaccines are currently being distributed statewide to hospitals, pharmacies, and I'm happy that we have a local pharmacy that is already dispensing them, local health departments, freestanding ERs, and other clinics. We already talked about who's eligible right now, and it's already been stated, but just want to reiterate, Texas has 1.83 million confirmed cases, and we've had almost 29,000 deaths. Fort Bend County has had 36,526 confirmed cases and 397 deaths. Currently, Governor Abbott has no future plans to curtail the virus and no plans to shut down Texas, even with the current surges. There is, under his executive order, some parameters that triggered bars and restaurants from reducing capacity. That is something that happened recently. Governor Abbott is not allowing local communities to further make restrictions. In other words, recently the city of Austin tried to implement a curfew, and the governor, under the Attorney General, sued the city of Austin to limit their ability to establish the curfew. So as of right now, the cities are guided and the counties are guided by the governor's executive order. So basically, that is what's taking place right now. What we're encouraging everyone to continue to do is to mask up. There is no substitute for not wearing the mask in public. This is an essential component. Even if you've already had your vaccine, we need you to continue to wear your mask until the CDC says it's safe not to do so. The second thing is, although it's been redundant, we want you to continue to practice social distancing. That is so essential. We encourage you to avoid large gatherings, and we encourage you to make sure that you're using good hygiene. These are the principles that is based on science, as the city manager stated. Science is what's guiding these medical decisions, not political decisions, not opinions, but facts based upon the medical experts and the science and the facts that we have now. And so we're going to continue to work as a state to do everything we can to improve the efficiency of the vaccines, to make sure, and I have some numbers on that in terms of right now, Texas has, as of yesterday, distributed 1.3 million doses of the vaccines have been shipped to Texas. 439,502 doses have been administered to Texans across all of our 254 counties. And recently, as of yesterday, Fort Bend County had received 1,000 doses. And so we know that that is not enough. As I understand, the county has already received over 5,000 requests on their website. And so we want people to continue to be patient. And we want to make sure that the first people that is eligible under categories 1A and 1B get those vaccines. And it's my understanding that the governor has then will consider, as I've requested, our teachers who are, really putting themselves at risk by, in-person learning in the classroom. So we hope that teachers will be in the next line as well. So we want people to continue to be patient. We do believe that the numbers in terms of the available vaccines are going to be going up in the very near future. We will get through this together. And again, I want to reiterate my thankfulness to the city of Missouri City for their being on the front line of being transparent, keeping our citizens abreast. And then as we get more into the legislative session, COVID-19 is a top priority for the state. Texas has one of the highest numbers of positive cases. In fact, Mayor, we had one of the first cases in the state right here in our area, within the Stafford, Missouri City, in terms of Texas. One of the first confirmed cases was in Fort Bend County. And so Fort Bend, as it's been stated, is in the red zone. And so we need to all be on high alert to continue to stay safe, to continue to do what we can to help flatten the curve. So thank you again, Mayor and City Manager in Missouri City.
Thank you. I want to take this opportunity to see that if we have any questions from our live stream or any others that are here.
We have several questions. The first one is, will the state legislature address the response to the pandemic during the special session?
Sure. I will have State Rep. Ron Reynolds come and answer that.
Well, we will. In fact, I've been in touch with the governor's office, and one of the top priorities that we have as a state, just like when it came to our response to Hurricane Harvey and the legislature dealt with that, one of the first things that we will be doing when we reconvene next Tuesday is dealing with our COVID response in terms of resources, allocating more robust plans to get the vaccines to our local communities like Missouri City and Fort Bend County, making sure that we have more access to funding to get information out to the general public. And so that is a part of the appropriations process. One of our Fort Bend County residents, I'm happy to say, Dr. John Zuras, a former state representative, my colleague, is now overseeing the state's response to COVID. So I've talked to Dr. Zurwas, and he has assured me that we will be working diligently to do what we can to keep the citizens in Texas safe. I'll be the first to say we haven't done as good of a job as we should rolling out the vaccine, and we intend, as I stated with this panel, to improve that, to get it especially in vulnerable communities. That has been a problem. Many of the people who need to get the vaccines currently don't have access to it. I've talked to some of our providers locally that are in daycare, extended senior facilities. They need to get these vaccines very soon. There's a high mortality rate with those compromised immune systems. So we need to do a better job, and it is my belief that the state is committed at the start of the session in making that our top legislative priority to address COVID, to get the vaccine distribution under control. So we know there's a problem. A part of it is at the federal level. A lot of it is guidance that we're getting from Washington, and that we all know has been unfortunately very dysfunctional. And so we believe that they're working through those things, and we've already received some commitments, as I stated earlier, that there should be a implementation of the Defense Production Act, which basically the government is basically ordering the pharmaceutical companies to mass produce the vaccines. That is the only way we're going to be able to produce the type of vaccines to get to the states. And so the short answer is yes, we will make that a priority going forward at the start of the session.
Thank you, State Representative Ron Reynolds. Before we go, I know that there's more questions, but if you're watching at home, if you're live, and if you have a particular question that you wanted to answer, please put it in the comment, and then we will make sure that we get those answered. But go ahead.
What is the status of the vaccination of first responders? How many have been vaccinated thus far? How many more still have to go?
We'll have it.
Yeah, so thanks to our partners in hospitals, urgent care, and pharmacies like Glen Lakes. Pleased to report that we've accomplished almost 95% vaccination rate for our first responders in the fire and EMS first responder group, which was the first 1A phase, part of the first 1A phase. So we should be done by the end of this week and be 100%.
Thank you, Chief. Next.
What is being done to address the rising number of hospitalizations in our area?
Well, that's a tough question to answer, because we only have so many beds, and we cannot anticipate the rise of cases that we're going to have. What's happening at the medical center, they've actually moved, they've designated a lot of general beds and converted them into ICU beds, and that's opened up a lot more beds for sick people. I'll give you an example. A few weeks ago, the medical center had divided their bed usage for ICU capacity into a phase 1 non-pandemic and to a phase 2. We've been in phase 1 for many, many months, probably since it all started. And just a few days ago, we actually went to 100% capacity. So they were first forced to go into phase 2, which means they've opened up more beds. So now our capacity in the medical center is 81%. So that's good. But it's very hard to tell what that's going to entail, because we don't know what's in store for us in the future. That's why it's very important for us to get vaccinated and to just do the public health mitigation measures that we've been talking about for months and months.
Thank you. Yes.
One of our viewers is asking, is Fort Bend County shutting down? Will we be shutting down?
Fort Bend County is not, to my knowledge, Fort Bend County is not shutting down. What's happening is it has put itself in a red zone, which means the gathering no more than 10 people. And they're in that process of, like State Rep Ron Reynolds said, They have received thousands of vaccinations, and they're working through that process. From my understanding, there's been 5,000 people that have registered, so they're working through that process to make sure that it is going smooth. I had the opportunity to be on several emergency operation calls with our acting chief, fire chief, Mario Portita. And in those calls, I mean, we're constantly dealing with our physician who's over the Fort Bend County. I mean, to my answer, they're not shutting down, if that's what I'm understanding.
What is the status of the small business loan program?
I would let our city manager answer that.
Thanks a lot. Obviously, the response to COVID for us dealt with, not only, how do we keep people safe, what measures we take to inoculate our community as much as possible, but also to our response to ensure that our businesses remain stable, and also too that our businesses within the community grow after that. So we enacted two things to do that. One, we work with our partners, both the county and also the federal government. We enacted through the CARES Act a grant program to help small businesses that were struggling become stable. Then also too, we provide grants to help people who are struggling with their mortgages, having a tough time with paying their utilities, and therefore. The second part of that is how do we move now that we think we're getting some stability, how do we move businesses from being stable to also putting them in a position where they can help to expand and grow, as some of our businesses are also dealing with those challenges too. And from that perspective, I've proposed to the council in the budget a loan pool that the city would invest $1.5 million into the pool, and working with SBA and some of our other non-for-profit partners, we would generate a $15 million pool for businesses, which is a 10-to-1 leverage. And those dollars would go in three parts. One, helping businesses deal with working capital needs that they have as they come out of the experience that we're having with COVID, but also two, helping businesses acquire real estate and do the things that they need to invest in property that would help them expand their businesses. And so what I anticipate moving forward now is we're going to have more of a conversation about that program. It's been introduced to the council 2 council meetings ago. We do have it on a planned agenda to have more discussion. But I've recommended to the council that we move ahead post haste, because I think it's truly important not only that we help to stabilize businesses, but that we also position them so that they can continue to expand and grow. Businesses are the lifeline of our community and in terms of our economy. We've been fortunate here that during the time of COVID that our sales taxes went up and that our real estate tax base has been stable. It's important from a financial standpoint that we put measures in place to allow that stability to stay there. So we're going to be having more discussion about that to ensure that council not only have all their questions answered, but also to ensure that the community has an opportunity to provide feedback. And that discussion will take place at our upcoming council meeting this month.
Thank you.
How is the PPE going to be handled for Missouri City residents who live in Harris County?
Chief, why don't you go ahead and respond to that?
We received a collection or a cache of PPE kits that our emergency manager is coordinating through requests for personal PPE kits. And that's both for the Fort Bend region of our city and the Harris County region. The emergency manager can be reached, there was a contact number on here, at 281-403-8500. 281-403-8500 to request one of those kits. And that's for both regions, Fort Bend and Harris.
Thank you, and I just want to remind everybody too that we are inviting everybody this weekend. It's to attend our free Eagle Scout PPE and food distribution this weekend at the City Hall complex. So that will happen this weekend, and more information will be on the website as well. So we'll make sure that we put another announcement out there so that people that's in Harris County, along with City of Missouri City, that can take advantage of this situation.
Have the Phase 1C vaccinations been administered yet?
Is that for Missouri City?
I'm assuming it's from Missouri City.
Yes, it is. Chief, you want to take that?
We did the 1A. So 1C?
1C, yes.
Up there in the,
Oh, right.
I hope we're there yet.
I'll take that question. So the committee that was talked about, EVAP, was convened by the governor, and it's headed, where they make recommendations of how we're going to distribute and allocate vaccines in the state of Texas. They give the recommendations to Dr. Hellerstedt, who is the health commissioner for the state of Texas, and then he has to sign off on it, and then it goes to the governor, and they sign off on it, and then it comes back to us. Right now, so the phases are Phase 1, Phase 2, Phase 3, Phase 4. Phase 3 will be where the general public will be getting their vaccinations, but that's not going to happen until the summer. Right now, we're in Phase 1A and Phase 1B. 1C has not rolled out yet. So Phase 1A is basically where you have your first responders, your healthcare workers, and those people that work and live in the long-term care facilities, nursing homes. 1B is not occupation-based, so it's not based on your occupation. It's based rather on your age. You got to be over 65, or you have to have a medical condition that's listed on the website. There's several. I'm not going to go into that, but you can see that on the website. And if you have those conditions, you now qualify to get it done. So we're in Phase 1A and Phase 1B. We are still not in Phase 1C, but stay tuned because it's coming soon. Thank you.
All right, we have any other questions? All right. So if we don't, I want to take this opportunity to thank all of you who are watching at home. This is our first time that we're trying this, but we'll promise you, as State Rep Ron Reynolds said, this is going to be an opportunity to be transparent with our citizens. So we've decided to go this route and to come to you every 3 weeks. So if you do have questions, please feel free to reach out through our social media campaign. I do want to take this time to thank all of our panelists who are here, that's with us, that was able to answer some of your questions and go through this process. Lastly, I want to thank Acting Fire Chief for his hard work making sure that our first responders, our police, our firemen, and everyone that needs to be taken care of, that's been taken care of. As you recall, he said 92% to 95% have been taken care of. Lastly, I want to thank every Missouri City resident who is a healthcare employee. Thank you for what you do for our community. Thank you for helping, because I know you are, or you have been, a front line to City of Missouri City with this COVID. So thank you once again. If you have any more further questions, please feel free to comment, so this way if we don't answer it today, we can come back and answer it again. Once again, thank you. God bless you.